Okay, so in terms of my journey to medical school, I think I have a stranger journey to becoming a doctor than most people, actually. I might be the only, well, I make this claim, I don't know if it's true. I'm sure I'm the only doctor in the UK that doesn't have any A-levels. So I'm from a non-traditional background for medics. My mum's a receptionist. My dad had a kind of middle management position. In fact, I did a talk, well, I went to a talk recently in which one of the professors there, Professor Marson, said, you be what you can see. And actually where I grew up, there weren't any doctors. So going through school and then going to medical school at 18 was just not something that was it's just not something I was aware of. It's not something I ever thought I could do. So I didn't. I was an average student. I went to college and I dropped out and I ended up working at a bank. And my God, did I hate it. I was absolutely terrible at it. I used to lose money all the time. It was just awful. And I remember thinking to myself, you know, what am I going to do with the rest of my life? And I remember thinking that I just really wanted to spend, if I was going to work for the next 40 years, the next 45 years, you know, perhaps even till I'm 70 or 75, the way things are going, you know, I want to do something that I'm passionate about, something that I want to get up in the morning to do. Unfortunately, at that point, I didn't really know what that was. So I went and I did an access to teaching course, which is like sort of like a pre-foundation course even. And what I discovered during that course was effectively that I love learning and just addicted to learning. So I went and I did a degree and I was lucky enough to get accepted into a university, a red brick university, effectively without A-levels, just with the access to teaching course. And that was, in terms of how my career has gone, that's kind of the pivotal moment, that sort of the pivotal decision that sort of springboarded me towards medicine later on when I needed to do that, because I had the degree, which made me then eligible to be able to do GEM when I wanted to. So I went on, I did my theology degree, and that was really wonderful. But there was never going to be a career in that. So I decided that I wanted to be a doctor. I'd been a volunteer for the Red Cross and I'd been a first aider, and I'd been unfortunate enough that a couple of people around me, and touch wood, this has only ever happened to me once since I started medical school, but pre-medical school it used to happen to me all the time, which is the irony of that is insane. But people used to just sort of collapse around me all the time or die, and I would have to use these first aid skills. And I remember this, I used to waitress, and I remember, unfortunately, there was this old chap who'd bought his wife and his sister for a carvery, and he'd gone to fetch the car, and very sadly he'd passed away in the car, and someone had noticed and they needed a first aider, and they sort of, you know, the guy that was the actual first aider was away, so I was sort of their backup first aider, and I was really young, and they kind of like dragged me out to the car park and the chap out of the car, and I did CPR. And the paramedics came, and the paramedics worked on this guy with so much passion and, you know, so much commitment to saving him. And he was, you know, he was a really, really old guy. He must have been like, you know, 90, but you wouldn't have known for the effort. They put in as much effort with that chap as they would have with anyone. And I just found that so inspiring, that, you know, the efforts that they made to save this chap. And sadly, I think he did pass away. I don't know, because I didn't go to hospital, but I assume that he did. But from that moment, I was kind of really inspired to be part of the healthcare system. Now, when you interview for medical school, one of the things that they will always try and ask you, or they will often get you on, is they'll want to know why you want to be a doctor rather than a nurse or a paramedic, etc., etc. And that's a really tricky question that you need to reflect on. And so what I would say is, when you do your work experience and things like that, think about things like that and reflect and write down even what your experience is. So why do you want to be a doctor rather than a paramedic or a nurse? So when I sort of had that epiphany and I decided that I wanted to work in healthcare, I sort of considered all occupations. But the reason that I really wanted to be a doctor was because, you know, like I said, I found when I went back to do my course, I realised that I have an absolutely voracious need to learn. And as a doctor, you are going to be studying for the rest of your life. You know, whatever you go into, even if you're an expert consultant in whatever it is that you end up specialising in. There's always going to be new information that comes out. There's always going to be new studies. There's going to be new technology. So even when you're at the top of the game, there's always going to be someone in Canada, someone in America who's teaching you something. And, you know, that's something that excites me about medicine, the idea that for the rest of my life, I'm going to be learning and growing, passing that on to my patients. So, you know, that was kind of the thought that I was having when I was on my theology degree. So I had decided to try and take the GAMSAT, and I took the GAMSAT 3 times before I passed that exam. It is still the worst exam I've ever taken, and I have graduated from med school. I hate that exam. It took over my life for a few years, but I was so committed to wanting to be a doctor that I kind of pushed on with it. So I went through my theology degree. I finished my theology degree, and I had my son, who is now 8 years old. And at that point, I think everyone thought the medical dream was done, but it was not. And I passed the GAMSAT that year, and I started medical school in that September run. Going to medical school has been the greatest thing I've ever done for myself. It's hard being a doctor. It has its moments, but I love being a doctor. It's fantastic, and I really loved medical school as well. I have to say that being from a non-science background, especially because I had really poor kind of science skills at school, I found the preclinical phase of medical school quite difficult. If you're all biomedical sciences degrees, you will have a massive leg up on me, really, I think, because everything was new to me. So when I was doing, you know, all of the anatomy, all of the physiology, that was completely new. So I found for those first 18 months of GEM that I was really playing catch up to people who'd done like biomedical science degrees or biology degrees. Once we got through that initial period, because obviously a medical degree is, I'm sure you're aware, whether you're aware of this or not, but a graduate entry medical degree is usually split into 2 distinctive parts. So there's preclinical, which is 18 months, and that's where your year is cut off. And then there is your clinical phase, which is the other 2.5 years. Once you go into clinical phase, you mix with the other undergraduates. I found once we went into the clinical phase for it, that the degree just became much, much easier, because you've already kind of learnt what you're going to learn in terms of the science, and you're just then repeating yourself. And I found that much, much less stressful, because it's much more focused on being on placement, learning the soft skills, learning your examination skills and things like that, rather than learning biology, which was quite difficult for me. So I finished medical school, I graduated medical school, and I have gone on to do my foundation years. So COVID has obviously thrown a spanner in the works in terms of my foundation years, but I have done rotations in cardiothoracic surgery, cardiac surgery, I should probably say, hematology, child psychiatry, obstetrics and gynecology. These all feel like such a long time ago now. Geriatrics, which was based in A&E. It's not your standard geriatrics. It's a bit different. ENT pre-COVID. And you know, I don't know if you have any questions about foundation or anything like that, but my plan now is, and actually the application's open today, but I'm applying to be a surgeon. So I've come a really long way from being someone who had been, you know, I couldn't even tell you how many years ago it was, you know, having left school with no A levels, you know, working in a bank, feeling very despondent, having absolutely no idea what I wanted to do, to now being in a position where I feel I have quite a strong application to go on to core surgical training. And yeah, it's been a heck of a journey. But yeah, if you have questions or if you'd like any tips for getting into medicine, I have some of those that I can share with you if you'd like.
Yeah, I mean, your story as a whole is one of the reasons why I was particularly excited to speak to you. You came from a background of where there was no medical experience. You didn't have a clue of what you wanted to do, and now you're doing work experience in neurosurgery. You've really excelled. I think it's just proven to people that you can progress on what you want to do, no matter what your experience is. Yes, it's going to take time and effort, but I think you are a prime example of, as long as you put in the work and the effort, as you said with the GAMSAT, you're going to get there. In terms of the GAMSAT, is that the only exam you sat, or did you? It would have been the UK CAT at the time. Did you sit that as well?
I didn't, because I don't have any A levels.
Okay.
Yeah, so I was never ever going to be eligible for the undergraduate pathway, so it was always going to be GEM. But obviously GEM is shorter anyway, so I really wanted to do GEM rather than the your standard undergraduate degree. In terms of the difference between the two, the only thing that I regret, well, in fact there are two things that I regret from doing GEM rather than the undergraduate degree, is that I think you get a much better experience of anatomy as an undergraduate. So more than, I mean, I don't know what you do on biomedical sciences, but more than likely, if you do an undergraduate degree, you will get a full specimen, and you will spend probably, I don't know how long, but a very long time kind of working with that specimen and getting to see the anatomy in all of its kind of glory, where you don't really get that on GEM. It's all prosected because of the speed of GEM. And I can't remember what the other thing that I was going to say is. I love GEM. It was absolutely brilliant. But because you can also you can do an additional degree during the undergraduate degree as well, which I kind of wish I'd had the opportunity to do, which obviously I didn't.
Yeah. With you sitting the GAMSAT, is there anything specific you found challenging? Or obviously everybody we've spoken to up to now has sat the UCAT, so they're all exclusively at UCAT universities. So how did you find the GAMSAT as a whole?
It's a difficult exam. There's no getting around it. But I think the key to the GAMSAT is this. I'm applying to be a surgeon at the moment, and there are things like cardiothoracic surgery, neurosurgery, where the odds are really against you. The odds are like 8-1, 4-1, whatever it is. The odds will never be higher than when you first apply to medical school. I can't remember what the statistics are. It's like 100-1 or something like that. How do medical schools deal with that? They want to put off candidates if they can, and that's what the GAMSAT is designed to do. It's meant to be a scary and horrible exam. So it lasts all day. It's like, I think in terms of sort of back-to-back paper time, the examinations is about 5.5, 6 hours long, but it is over the course of one day. Yeah. So it's it's an exhausting examination to take just physically. It's also very challenging, and a lot of people struggle with the GAMSAT for different reasons. So as a someone with a non-science background, I struggled with part 3, which is the science portion. But I know a lot of my colleagues, so I don't know if you know how the GAMSAT is broken down, but there's a first part, which is a humanities. All of the questions are like Mensa style questions. So in theory, you should be able to work out the answer from the text. You shouldn't need to have prior knowledge. So there's the humanities section A, there's an essay, and then there's part 3, which is your science statistics section. So I obviously struggled with part 3. I know many of my friends who had a science background struggled with either part A or part B, or 1 or 2. I can't remember how it's labelled. So it's very difficult in that whatever background you come from, unless you're from sort of a globally kind of well-rounded background, there's something in there that's quite difficult for you, whether it be essay writing or whether it be the science, etc., etc. I think the GAMSAT is really difficult because the style of questions are so unusual. So like I said, it's like Mensa style questions. And I think one of the ways of really getting through the GAMSAT is to practice and really work out the logic of the examiner who's writing those questions, because there is a knack to answering them it's more than just going away and knowing your organic chemistry, your biology, your physics, etc. You have to understand how the questions work, and once you've done enough practice tests, it kind of clicks. And for me, that was almost the key to breaking the GAMSAT down, was just spending the time and trying to work out, I'd do one, and if I got the answer wrong, I'd work backwards and sort of see how they got there from there. And there is a knack to it. But yeah, it's not a nice exam. I've sat medical finals and they were nowhere near as horrible as the GAMSAT, but it gets you into med school. So
yeah, from what I've discovered from talking to a few medical students, is the UCAT is you can revise for the UCAT. However, if you're scoring constant 500s, it is very difficult to boost out to a 720 or a 700. With the GAMSAT, do you feel it mainly leans towards how much effort you put in rather than the natural ability of like an aptitude test?
I think it depends what your background is. So for people like yourselves with strong science backgrounds, I think you might well find it much easier, because the chances are you've all written your essays before. You're going to have a fairly good command of humanities, even if you're not a humanities degree, because you will have been doing it pre-school anyway. So I think some of you might find, actually, if you go and sit it, that you smash it the first time through. The only problem with the GAMSAT is just, I think, if you struggle with learning its rhetoric, and I think it's a very individual thing, and the only way to do it is to prepare early, go and do a test, and then there's plenty of time to prepare. I mean, I spent years preparing for the GAMSAT. It took me about 2 years to pass it, I think. I just prepared. And the other thing about the GAMSAT is it's not about what you score, it's about where you score in terms of centile. So you have to be in the top 10 or 20% of everyone sitting that exam. So it's not about being good, it's about being better than the person sat next to you.
Yeah, I think that's again the differences between the UCAT and the GAMSAT. I think the default at the moment is to go and sit the UCAT as part of the medical admissions test. Mainly because it's more aptitude based and it's less strenuous, as you said. It's a lot less time consuming test compared to the GAMSAT. Obviously, sometimes that doesn't go in your favour when you have some students and it just gets cut off at for example, 70 percentile. So I do understand, obviously, the process of taking the GAMSAT instead and the advantages of that. So how did you find the transition from theology to medicine? And like, what tips would you, or what warnings would you give for somebody just starting out at medical school at Nottingham, or just in general?
So med school is difficult. It's a difficult adjustment, whatever your background, because if you're a person who goes to medical school, you're probably used to being in the top of whichever class you're in, right? You're always in the top. And then you go to medical school and you're in a room full of people like that, and all of a sudden, you are maybe in 9th centile or something like that. And I think that's one of the things that people really struggle with. It's difficult to learn to function in a cohort of that type, especially because at medical school they constantly pit you against each other, because that's how we do national applications. So obviously your foundation jobs are based on where you rank in your centile. So those things are really, really important. For me, med school was a real adjustment, because it was about learning how to learn effectively. So I'm a really hard worker. I've never had any problems with working hard. But what was new to me was how to learn scientific information well and get it to stick in. So when I first started med school, I would just work all the time. I would do every single bit of preparation. And then over the course of the first few months, I learned what really worked for me in terms of learning anatomy, because for me, anatomy is one of the most difficult things to learn. I can learn lists, I can learn physiology because I understand how once you learn how a process works, you understand how a process works, and you can work things out from first principles. But with anatomy, I think you have to be a very visual person. You have to be able to learn how to see things in space in an abstract way. And for me, that was incredibly difficult, and it took me quite a while to learn how to learn that. And for me, I used to make these really big, huge A3 drawings of the anatomy for every kind of thing that we did, and I used to find that really helpful. But yeah, it was really an adjustment in the sense of learning how to work efficiently, because I used to find that I used to get behind because I was putting so much work into my detailed anatomical drawings that by the time I'd done everything for, say TB week or cancer week or whatever we were on in GEM, because I'm not sure how undergraduate degree, but in Nottingham it's a PBL course, it's all very focused. Everyone else would be moving on and I'd still be on this, or they'd be on to that, and I could kind of build up. So that was difficult, but I got there in the end.
Yeah, with your preclinical years compared to obviously you've now graduated, but to your clinical years, how did you find the transition over the years? Did it go from more of academic learning more to like hands-on experience as the years progressed, or?
Yeah, so your preclinical years tend to be made up of lectures, clinical skills workshops, anatomy lab, etc. And then you transition onto your clinical years, which will have some lectures, but the learning by this point is largely expected to be independent. So you will be mainly on the ward on placement, and you'll be supporting that in your own time mostly with independent learning, and then they'll stud that with lectures on whatever it is that they think that they need to teach you. And it is a bit of an adjustment, but I think most people by that point are really ready to start flying and start learning how to be a doctor, because the first 18 months on GEM are fantastic, but biology learning is not necessarily the art of learning how to be a doctor, because medicine is an art as well as a science. So I always think of it as in those first 18 months you're learning what is the science of medicine, and then once you get to clinical phase you are learning the art of medicine, which is quite a different thing. And I actually found that quite fun. It was nice to be able to apply those principles to real patients, and actually would always find that things stick better in my head when I would see an actual patient. So you can learn a list about I don't know, anything, but then when you see a patient that has that thing, it kind of sticks in your mind forever that they had these symptoms and we did these investigations, and then this was the management. So in some ways it's much more, they're both very interesting in their own way, but I think most people are much more enthusiastic about the clinical phase. Yeah,
completely agree. So from people that are aware of your social media presence, especially for example your YouTube channel, that they'll know that you're a parent that successfully progressed through medical school. From that, is there any advice you'd give to prospective medical students, specifically ones with children?
I think whether you've got children or not, my advice is the same, is that you need to be really, really prepared, because med school is really difficult. And if you take away life and we all just go and do med school, you've got a lot of balls in the air, you're trying to juggle a lot and it's hard. But life isn't like that. And then, we all have additional kind of things that are coming in that try and distract us from medical school. For me, that was, having my son, but for other people, they might have caring responsibilities, with families, or they've got relationships that might need work, or they're having to maintain jobs. I know people who were on my GEM course who, were doing medicine in Nottingham but driving back to Manchester at the weekends because they had a job. That's going to be at least as time consuming as what I was doing as a parent. And I think I got very good at being very effective. So when I when I said that, you know, I did cardiothoracics and things like that, I managed to get my first choice rotation in foundation. I graduated quite near the top of my medical cohort. And the way I was able to do that, even with all the things that I had going on, is that I was just really, really organised. So I always have the mindset that you never know when you're going to drop a ball. So I always think in these juggling metaphors, I don't know why, but I always try and be ahead, because I know that I'm going to drop the ball at some point, so that when I do, I'm able to catch up. So for me, there was never a luxury of being able to get too behind or do too badly on an exam. So I was almost obsessively ensuring that I always had things done, that I knew things, just because I knew that, you know, one day, you know, my son's going to be ill and I'm going to miss this clinical skills workshop. So I need to make sure that for every other clinical skills workshop, I've been, you know, present and engaged and have known my stuff, so that when I do drop that ball, that no one comes and says, well, we need to have a conversation about whether you're fit to be on this course. And I would apply that, you know, to everyone, whether you've got a child or not. You know, a lot of people get stressed out and ground down by med school, I think, because there is so much going on. And I think the key to almost getting through med school is just to try and be really prepared and keep ahead of the curve. And then if life throws something at you, you're almost much better placed to deal with it. And that would be my advice on that.
Yeah, I completely agree with that. Obviously, you're the first fully graduated medical student, the first doctor we've spoken to. So what does a typical day look like as an F2 doctor?
So it very much depends. It very, very much depends what placement you're on, be it medical or surgical. So in terms of a medical day, you probably come in around 9 and you'll do ward round, and you'll be on the ward all day doing, you know, the ward jobs. So that will be things like your consultant. So your consultant will come round in the morning, you'll do ward round, and your consultant will say, order these tests, do this, do that, do this. And they will do that for however many patients you have, 20 or 50. And usually, depending on the size of the ward, it will be you and maybe someone else, 2 other people's jobs, to ensure that those jobs are done before the next day. So being a foundation doctor is often about being tied to the ward. Medical days are usually 9 till 5. And you will also have on-calls on top of that. So you tend to do more on-calls, in my opinion, as a medic, because you work shorter hours. On surgery, you tend to have to be in by about 5:30. Not 5:30. Like, I can hear you groaning in horror. 7:30, and you'll work again to about 5:30. In the morning, you'll do ward round. It will be a much shorter ward round. You have to be much quicker. The doctors, the registrars and the consultants will leave the ward. So on surgical wards, you tend to have to be a bit more independent, because they will all be in theatre. On medical wards, they obviously go to clinic and things, but in medicine, they tend to be a little bit more present. And then depending on what your job might be, you may well yourself be in clinic. Mostly foundation doctors are tied to the wards, but on certain jobs you will be out. So my first year, so during F1, I was pretty much tied to the ward the whole time. By F2, I haven't had any ward jobs at all. So on obs and gynae, that's a very practical job. So my time would be split between being on call, so having the emergency bleep, and going into theatre whenever a C-section needs to be done, which is really good fun, because, you know, they do, even emergency C-sections, they'll do maybe 3 or 4 a day. Early pregnancy unit, so discharging patients, very procedural, all of those kind of things. My geriatrics job was in A&E, so I was basically not tied to the ward again, so I would be in A&E all day, seeing patients and then trying to discharge them home, because being in hospitals, actually really bad news for all people. It has all kinds of health effects, as you can imagine, so if we can get them home, we absolutely should do. So for the most part, as a foundation doctor, you're going to be working on the ward, doing those ward jobs, doing ward round. But there are foundation jobs where you can do things that are a bit more kind of freeing, a bit more sort of interesting, dare I say. You'll also do your on-calls. So the time where you usually get to feel the most like a doctor and do the most clinical stuff is usually on call, because it's just you, really. So you might well get the crash bleep. They usually make for fun nights. And what you will be doing overnight or out of hours is basically just putting out fires and doing things that need to be done urgently. You should never be doing routine jobs. So it's things like going and reviewing a patient who's triggered a news score, going and seeing someone who's, become significantly unwell, writing time critical meds that have been missed or that someone needs, clerking new patients. All of those things usually make for a very busy on call, but it's usually out of hours where we tend to get our most clinically, sort of interesting jobs.
Yeah, I guess with obviously the application to medicine, is there just any general tips you will give to prospective medical students with applying, either that be through a different admissions test or the GAMSAT?
Yeah, definitely. So there's a couple of things that medical schools really want from you. The first is that we have a really terrible reputation as doctors of being arrogant. So you need to strike the balance in your interview as coming across confident, like you know what you're saying, but never come across as arrogant, because they really don't like it. We always want people who are compassionate. So compassion is a really great thing to sort of talk about in an interview if it fits and if it's relevant. So compassion is just something great to talk about in an interview, because you can apply it to everything and tick lots of boxes. So we should always have compassion for our patients, because sometimes, when we give the example of breaking bad news, we always think about telling someone they've got cancer. But actually, for pretty much any patient that's in a hospital, they're having probably a pretty bad day. So sometimes we get wrapped up in what for us is very normal, but for someone who's got a broken leg, who doesn't seem like they're top of our priority list, because we see broken legs all the time and they're definitely not our sickest patient. Actually, we know we need to have compassion for that person, because for them, that's the worst day they've had in ages. We also need to make sure that we show compassion to our MDT. So the MDT is a really big thing that you can talk about in interviews, because med schools really like this. So the multidisciplinary team, they really want to know that you are wanting to work as part of this team, and that we have a bit of a reputation in medicine as being hierarchical, thinking that we as doctors run the hospital, and, the nurses, the physios, the OTs, they don't matter as much. It's not true. And we need to dismantle that idea. So med schools often like to kind of ask you about things like the MDT. So the multidisciplinary team is basically everyone in the hospital. So that's your, that's your occupational therapist, personal therapist, physical therapist, nurses, ward managers, sometimes it can be people like social workers and discharge coordinators, and, us as well. Having compassion and working as we work in that team just makes for a better atmosphere for everyone. So I would suggest that if you do any work experience, really make that work experience work for you. So think about times where you've seen a junior doctor work with a nurse. Did they do something that you liked? Did they do something that you didn't like? I mean, try not to be super critical without reason, unless you see something really terrible. But really reflect and, write it down, so that when you come to interview later, you've got these examples that you can give that also showcases the fact that you've done that work experience. Because it's one thing to have on your personal statement, oh, I've spent 6 weeks befriending in X hospital. But if when they say, give me an example of a time you've seen good team working, you're almost double ticking boxes if you're able to sort of like signpost them to the fact, like, look at me, I've done this experience actually in a hospital, and I'm going to tell you this about the MDT. So there's that. And what was the other thing I always tell people? So MDT, compassion, actually knowing what we do as junior doctors. So med schools, I think, really have a problem with the idea that some medical graduates think that by being a doctor, they're going to see what they see on Casualty or Grey's Anatomy. They want to know that you know what a junior doctor actually does, which is why they want you to have done work experience. So if you do work experience or however you do it, try and fully understand what we do, which is, as a foundation doctor, it's often things like taking bloods, it's seeing new patients, it's scribing on ward round. We do carry the crash bleep, of course, but very rarely is the day-to-day job, kind of the, defib, heart starting kind of stuff. So be aware that they kind of have, a bit of a warning sign about people who if you think it's going to be as exciting as Grace, it's not. They do like to ask you about topical issues. So when I was interviewing for med school, I looked at all of kind of the topical popular medical issues that you might well have heard about. So for me, when I was interviewing, the Liverpool care pathway, which I'm sure you probably haven't heard of because it's a bit before your time, but this was a very controversial death pathway that we used to put people on years ago, and it got some really bad coverage in the popular media. So it was in the newspapers and they were criticising it, and it became a whole thing. So things like that I prepared for, because that's the sort of thing that sometimes they might ask you about. So I would because of COVID, I would think about things that they might ask you about COVID if you're interviewing anytime soon. Might ask you something along those lines. It'll be something that, something popular, something that you're bound to know, but it'll be something that they're looking for you to have reflected and give a well-balanced answer on. I would also advise that you stay away from ever being too critical of anything unless you've got real reason. There are loads of good books you can read as well, which can help you with your interviews for med school. So I think if you can have a really well-informed conversation at interview, I think that's really helpful. So I'd recommend you read books like Being Mortal by Atul Gawande. That's a fantastic book anyway, but our medical school actually gave them out to everyone. They loved it that much. So being able to read and discuss, that kind of like popular medical literature probably gives you a perspective that might help you deflect questions at interview effectively, because you'll have an interesting perspective. So Oliver Sacks is a good one. Atul Gawande is absolutely top of the list. Sorry, my bookcase is over here, so I'm just thinking what else. Probably those two, but definitely Being Mortal would probably be my top one.
Yeah, how at the time of you applying, is there anything that, now you've reflected back on that, is there anything you feel yourself could have done better, or anything you would have changed to increase your odds of successfully getting into medicine?
I think so. I said to read Atul Gawande, etc. So I didn't do that prior to my interview because I just didn't know that that type of literature existed, which is why I've mentioned it. I was already pretty prepared anyway, and I can't really remember what they exactly asked me to do. I would just say they're going to ask you something you're not going to be prepared for. Just take your time and be very measured. So sometimes I know that there'll be a station that you'll go into where it may well be some sort of nonsense station, or it'll be something where they don't expect you to necessarily know the answer, what they're looking for. If you find yourself in a situation where you're having to arrange something, or it's something that you think there's no way I should be at my level, I should know this, just do your best and be measured, because sometimes what they're looking for is to see how you'll deal with something under pressure. And just think about all of those soft skills, be measured, be considered, take a moment and breathe. And because as medics, we're always going to be in situations that are a bit dicey. So it's really good as an interviewer to see someone in a position where they're really uncomfortable. And if that person just stops, because we know as interviewers, we know that you're going to be uncomfortable because it's an interview for med school. But just to see someone, stop, take one, just one brief pause, take a breath, and then kind of attack it, just shows that you're a very considered and someone who's dealing very well with pressure. That would be my tip. That's how I would manage myself if I would go back and re-interview medical school.
Yeah, completely agree. With most presumably it was MMIs that you had a interview stage.
With what, sorry?
At your interview stage of medical school, was it MMIs or was it a traditional interview that you had? The multiple interview stations.
The mini stations. Yeah. So I think we had 8 stations and a bell would ring, and I still had that bell ringing in my nightmares. And you would do a station and the bell would ring, and then you would wordlessly move on to the next one, read your vignette or whatever it was, and yeah.
How did you find them compared? Because I feel like they're becoming more and more popular with universities. How did you find them compared to traditional interviews?
It was fine. It's very stressful, but actually that's how they do OSCEs. So it's something that you're going to need to get used to anyway. I think it's more, I definitely think it sets you a little bit more off kilter than a traditional interview, because in a traditional interview you've got a moment to build a rapport with the person that you're sitting talking to. When you're in a station and you move every 8 minutes or whatever, you're never ever really able to build a rapport. You're kind of just fighting that fire and then moving on and fighting the next fire. So I think it is more difficult to do the mini interviews. But also, and maybe it's just me, I think it was quite fun anyway. I kind of went in with the mentality that it was such a privilege to be there and to be interviewing for medical school. Like potentially there was a spot for me to go to med school, and it was such a privilege. And I kept thinking that all the way through, that between every station, I just kept thinking, this is a privilege. And I think that kept me calm, and I think it kept me focused. And, I was offered a place. I never interviewed once. So.
Yeah, that's perfect. I mean, being the first doctor that we've spoken to in the guest lecture series, I remember hearing you said something along the lines of you really enjoying surgery. Is this something like you could see yourself doing in the future? And is there any tips you could give an aspirational medical student in securing such a highly competitive specialty later on down the line?
Yeah, well, I mean, I'm applying to be a surgeon now, so that's in the process. So hopefully I'll start training in August, which will be brilliant. I have loads of tips. That is an entirely separate talk, because I can honestly give you all day about that. My top tip is effectively to be prepared. So if you are a person who's pre-med at the moment, or even if you're in your first years at med school and you think, you know what, I'm going to do surgery's for me. The key thing to do, I think, is to think about your applications now. So that sounds insane if you are a first or second year medic, because I'm talking about not your application from med school into foundation, but your application from foundation into specialty training. So that's 2 years out of medical school. But the reason that I'm saying that is because it is very competitive to get into surgery, but actually the things they want are not that difficult to achieve. The only problem is that people get to the final year of med school, they get into foundation, and there is a scoring matrix, which you probably have one knocking around because I constantly stare at it. There's a scoring matrix, and there's all these things that you can pick up points for. And there's so many different categories that you're like, I need to do this, I need to do this, I don't have this, I don't have this. But actually, if you start early enough to prepare for surgery, by the time you get to, so you're going to apply for surgery in your foundation 2 year, which, believe me, comes around super quickly, you are going to be just completely chilled because you've done it for the last couple of years. And it's literally just a thing of picking a project, pick one project a year, maybe 2 projects a year. Or if you do anything extracurricular, it's making sure that those extracurriculars actually work for you. They work for your surgical application, because not all things are created equal. So, for instance, one of the big things that you get points for on a surgical application is, so you get 8 points for organising a course. Now, when you get into F1, you're working full time and you're doing, you know, a 48-hour standard week. You know, I've done 72-hour weeks and, you know, things like that, you know, sort of nights and, you know, all of these things. And, you know, you're having to do audits and you actually want to have a life as well. The prospect of organising a course is really difficult because actually, who are you organising a course for? You know, you potentially don't know any medical students anymore because you're out of the university. Maybe you've moved areas, so you don't have any contacts at the university. So maybe you want to organise a course for the foundation doctors, but everyone's busy. You know, it just becomes an entirely huge nightmare. But actually, if you're in med school, I mean, here, Aaron, if you wanted to do surgery, you have 8 points already because you've organised this course. And actually, so if you were, a couple of years down the line, you would think, do you know what, I've got 8 points and that was so long ago, it cost me no effort at all. So just a thing of knowing early enough along what ticks those boxes for the big points, and then doing it early, and then making sure you have evidence for it as well. So you know, it's one thing to do it, but you actually have to have the correct evidence. So usually that would just be a letter from someone at the university or a doctor or something like that, to say that you've done it. And then, you know, you kind of just put it in a folder and then you forget about it. And by the time surgery comes around, everyone else is stressing about how many points they've got, and you're kind of like kicked back on a lilo with your massive portfolio because you've been, you know, strategizing for the last 4 years and everyone else has been doing it for 1 or 2.
Yeah, I completely agree. It's just about advanced planning in that sense.
Yeah.
You know, that's the, well, once you get into med school, that's the inevitable fact of you're going to be competing for these places. So I guess, as you said, planning in advance of getting these points in early, strategically spending your time where the points count or benefit you when it comes to that application. Yeah, I mean, if anybody's got any questions for Lauren, yeah. So Mira's got a question of where can we get the list of things to do for surgery?
So let me see if I can post it in that chat. So I have to say, oh no, I'm not done here. So let me see if I can find it for you. So it's called a points matrix. So let's see if I can find it. So it's a points matrix. It's here. So it will change. One of the downsides, obviously, of preparing early is there is a chance that it will change. But I think most of these things have been on here forever. So I would just say, you know, if you're definitely going to do surgery, just have a look at those things. And when you make your decisions, because your time is precious, you don't want to be kind of, you know, doing this, that, and the other, spend it, you know, breaking your back doing this, and then you get to apply for surgery and you think, well, I can't use that. That was pointless. Yeah, it's never pointless. It's all experience. But I think just being able to focus what you spend your time on makes it so much easier. So just keep an eye every year on whether they sometimes make very slight changes to what scores points. But yeah, do it as a med student if you can, because often, so you get points for courses as well. These courses are really expensive. So basic surgical skills costs £700. CRISP costs similar. I think ATLS is about £700 as well. But often courses and conferences are often cheaper for med students. So you often get the same points for going to a conference as as a med student, as a doctor. But actually you get a student rate, so you do as a student.
Yeah, Perfect. I mean, if no one's got any other questions, is there any way somebody can reach you? Maybe via your YouTube channel or your Instagram?
Yeah, so you can always ask me any questions about anything. I'm on Instagram at the Surgical Doctor, or there's a YouTube channel of the same name, which I'm going to make a video about this surgical stuff, but I'm currently going through the process myself. So I just want to go through that process before I formally put that in a video, just in case there's anything I think I can add. But yeah, feel free to contact me about anything.
Yeah, perfect. Again, I'd just like to thank you for taking your time out of your evening to come and speak to us, especially on bonfire night when you could be out. But yeah, thank you again, Laura.
All right, thank you so much for having me. Thanks,
Thank
Aaron.
you. Take care.